be talking about helpful ways to improve communication among healthcare professionals and their patients. You may not be working in the medical field, but we have all been a patient in a medical facility at one point or another. We have all experienced poor communication within the medical staff, and these strategies are not only helpful for medical professionals, they can also be helpful to you as the patient. After some of my family members experienced some very poor communication from medical professionals, I wanted to research ways communication can be improved between medical professionals and the patients that they care for. I will be explaining some effects of poor communication between healthcare professionals and their patients, the class and EVE protocols, and the importance of effective communication between medical staff. So poor communication between patients and medical staff can be harmful, leading to medical errors and non-compliance by the patient. In July 2011, the Institute for Healthcare Communication published an article about the impact of communication in healthcare. The article states that doctors and other healthcare professionals lack adequate training in effective communication. The article also states that less than half of patients discharged from the hospital could not identify the medication and the diagnosis that they were given, proving poor communication on their physician's part and probably also the nurse that was serving them at the time. Poor communication can lead to the patient feeling confused, leading to non-compliance. The patient that is unable to understand their medication regimen or the severity of their diagnosis cannot follow their plan of care correctly. A lack of effective communication can also lead to fear. The patient may begin to feel distrust towards their doctor and stop going to see them altogether. I know a lot of people have been to different doctors, and if the doctor is not very empathetic towards them, they will stop going altogether, which can really harm the patient. There are some creative protocols that can assist healthcare professionals with their communication. There are many different protocols for different situations, but I will be focusing on the two that I think that can be very universal. Two protocols that can be used in universal communication is the CLASS protocol. It stands for context, listening skills, acknowledge, strategy, and summary. And the EVE protocol, which is explore the emotion, validate the emotion, and empathetic response protocol. The CLASS protocol teaches about effective listening skills and the kind of environment that is conducive to effective communication. Communication should take place in a quiet, relaxing environment with minimal disruptions, and listening skills are also very crucial. You want to use open-ended questions, and clarification is a must. And you also want to acknowledge the patient's emotions, which kind of leads to our next point, which is the EVE protocol. And it is specifically designed to deal with emotions that may arise. So you want to explore the emotion the patient is feeling. If a patient is feeling anxiety, you may want to ask why they feel anxious or why they have fear. You want to validate the emotion. You want to assure that the patient is okay and that it is okay for them to feel what they are feeling. So if they are feeling angry, if they are feeling sad, let the patient know that it is okay to feel that way, and it is completely normal. Empathetic response, which I think a lot of doctors lack. Respond in a way that you understand the emotion. A lot of doctors just want to get you in and out, and they don't really care about how they respond to you. So communication is not only important between a patient and their doctor, it is also extremely important to have effective communication between your medical staff. I have seen what poor communication between medical staff can do. It can cause patient distress, and it can also create a hostile work environment. Poor communication can lead to disorganized teamwork, and effective communication is essential between a medical team. So there are many barriers to communication, but I have a few: personality differences, gender, generational differences, disruptive behavior, and hierarchy. It's extremely important, especially for nurses, to have good communication with each other, especially during shift change. You'll have a day shift nurse and a night shift nurse coming on, and you have to communicate to that nurse what happened during the day, if the patient is a new admit, what the diagnosis is, what kind of treatments the patient's had, medication, who the doctor is for the patient. So it is very important that you have effective communication, and even if, say, you don't like the other nurse that you work with, you still have to communicate effectively for the sake of the patient. So I have discussed the effects of poor communication between the patients and medical staff. the class and the Eve protocol, and the importance of effective communication between medical staff. So whether you work in the medical field or you have only been a patient in the medical world, communication is crucial. Communicating effectively with your patient can be very rewarding. It establishes trust and rapport. Communication is important no matter the situation, but communication among medical professionals is especially crucial. You have human lives in your hands, so it is very important to choose your words wisely. Thank you.